Hospitals in India are turning away patients as the country grapples with the coronavirus pandemic. More than 14,000 people have died from COVID-19 in India, and more than 100 million people have lost their jobs during the pandemic's economic fallout. Meanwhile, tensions are running high between India and China after a deadly border clash last week. Jeffrey Gettleman is joining us to talk more about all of this. Jeffrey is a reporter for the New York Times and a bureau chief there. You recently wrote an article for the New York Times detailing the story of a pregnant woman who visited 8 hospitals in 15 hours attempting to get care. Describe for our audience, Jeffrey, how does her experience compare to what other patients in India are seeing?
Well, it's a really sad story. India is experiencing a surge in coronavirus cases, like many other parts of the world, but the healthcare system here is already beleaguered and overloaded, was already beleaguered and overloaded before this crisis struck. India spends very little on healthcare per capita, something like $26 per person per year, which compares to thousands of dollars that the U.S. spends. Hospitals here are crowded on a good day. And in the last couple of weeks, as the number of coronavirus cases has spiked in India, we've heard these horrible reports of people going from hospital to hospital, to hospital, desperate for medical care, in critical condition. In this case, it was a woman about to give birth. She had high blood pressure. She was very faint. She had trouble breathing. And she went to 8 different hospitals. The doctors turned her away at each one, and she died in the back of an ambulance with her husband trying to save her life. I mean, it was a crushing story. And our information is this has happened dozens of times across India. It's happening to many people. It's not just COVID cases, it's also non-COVID cases. It's people that have, pregnancy issues, dialysis problems, an emergency, and the hospitals are not letting them in. Maybe they're full, or maybe it's that they're scared of getting coronavirus, and it's a real crisis.
Jeffrey, I remember when the pandemic started in India. India was being praised for the way that they locked everything down so quickly, and it was kind of like a shining star initially. What happened? What went wrong? And what is the government doing now?
Well, what's interesting is one reason why India did well in the beginning is because they put a lockdown across the country, the biggest one in the world. 1.3 billion people ordered to stay inside their homes, and most people followed the instructions. They didn't go out to the parks, they didn't socialize, they stayed indoors. The reason why they did that was exactly what just happened to this pregnant woman. These people knew across society that the healthcare system was a huge risk, and that if they got sick, they were really rolling the dice with their life in their hands. And so that fear across the society of, I don't want to get COVID because I do not trust our public healthcare system or the hospitals to save my life. It was that fear that kept people inside and obeying the lockdown. That lockdown lasted for 2 months. The government couldn't sustain it. The economy was too wounded. Too many people were out of work. So many people in India live hand to mouth. They need to work every day to earn a few dollars to feed their families. So the government lifted the lockdown. The instant they did that, the cases spiked across a country of 1.3 billion people with very poor health care. And now we're seeing the results. Many more cases, many more deaths, and really sad response from the healthcare system.
And coupled with that, Jeffrey, as you mentioned, is the economy. I'm curious which specific jobs and industries have been most impacted. Of the working citizens of India, who has been most directly impacted by the closing of the economy?
It's the poor people, the working classes. And I feel bad sort of being the bearer of bad news across, so many different fronts. But India is in a real difficult spot right now. The economy was not doing well for the last 2 years. India has grown immensely. It's lifted hundreds of millions of people out of poverty in recent decades. If you came to India 30 years ago and came back to India today, it's a totally different place. many wealthy people, many beautiful cities, many modern factories and call centers and software developers. India has a real up-and-coming economy in many aspects. But when this lockdown happened and when the global demand slumped, the demand for everything, for motorcycles, for cars, for software, for everything across the world, when that dropped, so many people were put out of work. And the problem in India is there isn't the welfare system. If you don't have any job, there's not really going to be a rescue for you. You're going to have to scrounge around on the streets for food to feed your family. So we've seen rickshaw drivers, maids, factory workers, laborers, construction site workers, everybody connected to tourism and travel laid off. And the estimate is 110 million people have lost their jobs, which is a bigger workforce than most countries have in total.
Wow, those numbers are dire and stunning. I want to ask you about something else. A clash along the border with India and China. It left, I believe, 20 Indian soldiers dead. What is going on?
Again, it's like, how much bad news can one country take? So India and China have a very vague border in the Himalayan mountains. These are the two biggest countries in the world. China is the most populous country. India is number 2, and they're very close in population. China is like 1.4 billion. India is 1.3 billion. The border between between the two countries is over 1,000 miles long, and it cuts through the highest mountain range in the world, the Himalayas. And it's not clearly marked. It never has been. But in recent years, both sides have been beefing up their military, China especially. And in recent weeks, China sent thousands of troops to occupy different positions in the Himalayan mountains. The other week, the Chinese troops came into contact with the Indian troops, and this enormous brawl broke out. It was almost like a prison fight or a rumble. No guns fired, no artillery, no modern weapons, but soldiers fighting with their hands, with clubs, maybe with knives, a really brutal hand-to-hand battle along the border between these two armies. And India lost 20 soldiers. Since that's happened, the tensions between these two countries has shot up. And the stakes are high. They're both nuclear armed. They don't have a good relationship. And this border is decidedly fuzzy. There's no real way to know which is the India side and which is the China side. So in the last few days, we've seen thousands of troops from India going into the border areas to back up the forces that are there. And India and China are talking with each other. They say they're trying to work this out, but the fear is that neither can really give any ground, and there's not like a clear solution in sight.
Jeffrey, thanks a lot. You know, with all this talk about the coronavirus here at home, sometimes we are not focusing on some of the hot spots that are bubbling up around the globe. So I'm really glad that you stopped by to talk to us today. Thank you.
My pleasure.